And welcome back to Ask the Doctor. I'm your host, Mike Berger. We're joined today by Dr. Lou Saucedo of Accident and Injury Chiropractic and former football star Darren Woodson, former Cowboy football star Darren Woodson. We're about to tell you a little bit about chiropractic and how it can help you. We'd like to remind you that you can join in by simply calling the number you see on your screen. It's 1-877-659-2211, or you can email your questions to lsaucedo@accinj.com. I'd like to ask a question about what are some of the typical auto accident symptoms that you run into, or maybe people need to be aware of, Dr. Saucedo?
Sure. A lot of times you hear patients that have been in motor vehicle collisions. Neck pain is the most common one you hear. A lot of people call it whiplash. And what whiplash is just soft tissue injuries to the neck. When your neck is forced forward and back quickly, you can cause muscle spasms, tightness, and stiffness of the muscles of the neck, which in turn causes neck pain or neck stiffness. In addition to the whiplash or other things like that, you're going to also have upper back pain, low back pain, also have injuries to shoulders because of the seat belts. You can have injuries to your knees if you hit the dashboard with the knees. You also have injuries to your hands and your wrist as you go, because you can get your hands caught into the steering wheel and cause injuries to the wrist. So anywhere that you can have some type of joint that could be injured in a motor vehicle collision, it can happen in that.
And it's much like the football game. You know, I listen to what you're saying as far as auto accidents. It's exactly like a football game. Every week, every Sunday, you're running into a guy or another player, and it feels like an auto accident. It's the neck, it's the back, the shoulders, it's the back, low back. Yes. And I think the easiest way to fight against that is the immediacy, getting in there so early and knowing who you're dealing with.
Absolutely, and that's what we want you to know is that once you're in a motor vehicle collision, you need to be checked out by a doctor, someone that specializes, someone that focuses and really concentrates on these type of traumatic injuries. And what you do is we can get a thorough history and examination on you to tell you what's wrong. It's one thing to know that you're hurting, but what we try to do at Accident and Injury is to tell you what's wrong. When we do a history and an examination, we can actually find out what is causing the pain. Is it a muscle? Are it the ligaments or the tendons?
Sure.
Or is it a disc injury?
Yeah. And you might be surprised because in an auto accident, when the car stops, the driver or the passenger doesn't stop for that split second.
You're correct.
And that can cause a lot of injuries that you wouldn't even think about.
Yeah, because we're looking at the person. The car keeps going. The car stops automatically. You keep going where the car was going. And there's different forces on the occupant than there would be on the vehicle.
Okay, the phone lines are open. Susie's in Fort Worth. Susie, how can we help you?
Yeah, I was in a car accident a week ago, and I'm just now beginning to feel pain in my neck. Is that normal?
That's just what we were talking about.
Yes, it was. Yeah, it's called delayed onset of pain. Your body has chemicals that will make sure that you can handle those type of situations, and you don't feel the pain for a while. But as you go through and those chemicals start to wear out, you'll start to feel the pain in those areas that you've been injured. And that's why we recommend that you get seen as soon as possible. The sooner you get into the clinic, the sooner we can diagnose those injuries, and the sooner we can get your treatment.
You said clinic, but you actually have a number of clinics around the Dallas-Fort Worth area, don't you?
Yes. One of the big things about accident and injury is we have multiple clinics around the Metroplex to service people that have been in motor vehicle collisions.
All right, we have a question from a viewer on our website. Joe in Fort Worth asks, I went to the hospital after my accident and they dismissed me. Do I need to see another doctor?
Yes. My answer to that question is yes. When you go to a hospital, you've been in a significant enough injury to where you go by ambulance or you go on your own. And what they do is they want to make sure that you don't have any life-threatening injuries. And then they also possibly give you some type of pain medication to help you get over the soreness, but they don't treat the injuries that we treat. What we do is we focus on those injuries, and then we curtail a treatment plan based off of the injuries that you have.
I think it's real important also, and maybe this is a good place to interject this, where doctors of chiropractic, insurance companies are all working much closer than they used to. So you don't necessarily need to worry about that. You're going to get treated.
Yes, and that's what they have a special subset what they work with patients. What we do is we want to make sure that those traumatic injuries that you have, that we want to fully diagnose those injuries. And then we have a treatment plan, and we have chiropractic treatment. We also use active rehabilitation, passive care to help with the pain, and we'll get you through to home exercise programs, and we'll help you get out of pain.
And I think that's what separates accident and injury from most, is the professionalism and the knowledge and understanding exactly how to treat, whether it be a football player or a person that's gotten into an accident, knowing exactly how to treat them and knowing the urgency. And I think that's one of the things we really have to focus on, is the urgency. Get in and know that accident and injury, and the doctors at accident and injury know what they're doing, and they're going to get you in and out as soon as possible.
Yeah, it's like you. If you're in an accident, if you got hurt in a football game, they don't wait two or 3 days down the line to find out what's wrong with you. They want to know right then. They'll take you into the locker room before halftime if you're injured in the first half, get you examined, find out what's wrong, and then determine if you're ready to go back or to get some treatment.
Exactly.
We've got a few more seconds before we have to take a break. And I'll remind you again, you can certainly call at 1-877-659-2211 with your questions. We'll get you on as quickly as possible. In all the years that you've done this, Dr. Saucedo, what significant changes have you seen that make it so much better and so much more maybe easier to do?
You know, technology is one. There's a lot of technology now that can help us diagnose these type of injuries where we didn't have those before, whether it be MRI, CAT scans. There's certain modalities that we use to help decrease pain that we didn't have in the past. All those things coming together can help these injuries heal quicker and help you feel better faster.
All right, we're going to take that short break right now. By all means, stay with us. Again, you can call us at 1-877-659-2211 or email your question to lsaucedo@accinj.com. We'll be right back.